adolescents and young adults about what those target behaviors are. It's a method of communication, which means that all the skills that we do are sort of meaningless if we can't get them out in language, verbal or nonverbal. And so everything we do is mediated by that language. And so MI really, if people are like, is it an intervention? Is it a this? Is it a manual? It's a method of communication, and it's a way of reinforcing motivational language to increase intrinsic motivation for change. So motivation that comes from the inside versus from reinforcements or rewards or guilt, which is considered extrinsic as well, or somewhere in the middle. So tailored motivational interviewing is how we have developmentally and culturally tailored MI for youth settings and diverse youth settings. So I'm going to just touch on, in the short period, developmental tailoring, tailoring based on communication science studies that we've done, in terms of the diversity aspect, how we've incorporated anti-racism and cultural humility in our tailored motivational interviewing, how our training is theoretically and empirically driven, and if we have some time, share some in a video example. So in terms of developmental tailoring, our text on MI with adolescents and young adults goes into a lot of detail about how we've developmentally tailored motivational interviewing. And so some of the key points that I want you to think about, and we'll have a little bit of discussion about, is how do we understand motivation from a developmental context? What is motivating for adolescents and young adults might be different than what is motivating for adults. And we also know that the reward centers are highly rapidly developed in adolescents and young adults, but that the executive functions may be a little bit slower to catch up. And so when you have that discrepancy between heavy activation of reward systems and a slower response of the executive functioning systems, that's kind of creates some of the behaviors that we define as risky. But you can leverage that reward system by finding things that are intrinsically rewarding or even extrinsically rewarding, but put people in the right direction for change. We want to understand language from a developmental context, and that how young people speak may be different from how adults speak, but we don't want to fake it. You know, we don't want to try to talk like young people when it's not us. Instead, we want to try to engage and understand. So just like you would work with someone whose English is not their first language, you're not going to be able to suddenly speak Spanish or suddenly speak French. You're not going to suddenly speak adolescent, but you're going to use your skills to try to understand their language and their point of view. We prioritize autonomy support, and we think very specifically about how do we support autonomy in language? What kind of statements do we make that supports autonomy with language? And how do we manage counter change talk, which might be more present in adolescents and young adults, and that we know that reductions in counter change talk may actually be more predictive of behavior change than increases in motivation statements. And then finally, how do we leverage those developmental priorities? How do you utilize the influence of peers? How do you utilize this identity development that youth are going through to create some motivation for change? How do you leverage that? So in our first group discussion, we're going to give you guys about 10 minutes to think about how you might tailor how you do MI or how you think about MI in terms of cognitive and brain development, emotional development, and social development. And Heather, I sent you an email about how many groups do you want to break up into? We could do smaller groups and have people respond in the chat with what they came up with, or we could do kind of larger groups and have people report back verbally.
It would be great to report back if that works for everyone.
Okay, so let's break us up into maybe, you know, larger groups with 4 or 5 separate groups, and then okay. I'm going to ask the group to come up with a reporter. We'll give you 10 minutes, and Heather, I guess I'll need you to time it because you'll have to bring them back.
Okay.
Is that all right?
Yep, that works.
And random is fine, and then we come back, the reporter will kind of just report back what they came up with in terms of developmental tailoring.
Okay.
So I would say 4 groups, maybe.
Okay. Let's see, and I might have to, hang on one second, I'm going to close the rooms. I was looking at the time. Oops, sorry about that.
Sorry,
I didn't put the time in, so it's not allowing me to open them. It's going to take 30 seconds for me to open
oh,
them.
okay.
So apologies.
So come up with a reporter, and then the reporter will come up with sort of one key takeaway.
And you said 10 minutes?
10 minutes, yeah.
Okay.
Let's go with 8 since we kind of lost a minute
Sure.
or two. I just want to make sure we have enough time. 8 minutes.
Could you send me
Sure.
back, could you send me back to my room? This is Kate. I was in with Janet. Okay,
Yeah.
thank you. Thank you.
There we go. Everyone should be able to join.
And I won't join, so I'll let them.
Okay, no worries.
Yeah. But I'm going to broadcast a message with just I think it'll let me, oh no, that's you. Okay. We don't have to do that. Yeah, that's good. They should know cognitive, emotional, and social development. We could broadcast the message on cognitive, emotional, and social development, but that's okay.
Right. Oh, and I can broadcast it if you want me to, because it's not letting me join a room because I guess because I'm a host.
Okay, yeah, just broadcast and just say, and Alex just joined, so I don't know if she might need to be assigned.
Okay.
I don't see anything about breakout rooms on my bottom tab.
All right, I'm assigning you. It's letting me do it for some reason.
Okay,
Yeah,
great.
I'm just going to assign you right now. And
Appreciate
then
that.
I
Thank
can
you.
broadcast the message. So
Oh,
it's letting
great.
me do it. Yeah.
Thanks.
You can take a minute, take a break. / brain development, emotional development, social. If we don't have time to get to the video, I might just send you the sample link.
Okay. How are you doing, Sylvie?
I'm doing good. How about
Good.
yourself?
Good, thank you.
Good.
Yeah.
And your timing, right? For me, the 8 minutes?
Yes. Yeah. I assigned it to the group, so should
What?
automatically happen, but I'll make sure.
Oh, you can do it, assign it automatically. Oh, and then it'll do the reminder to automatically. Oh, I haven't figured that one out yet. Okay.
It's like an option on the side, and I think that's why when I started it, I forgot.
I did not realize that this was getting broadcasted to Mint. I mean, I have a lot of my buddies are on they saw my name. So have you been doing that for all of these?
Yeah, so I guess it's a previous group I wasn't a part of, but it restarted recently. And so and so we decided we wanted to reinitiate these meetings, and it's been really cool. It's been great dialogue. So
Good.
And it looks like there's about 5 minutes. So.
Okay. I think just in the interest, we'll see how I'm doing on time. There's a chance that I won't do breakup rooms. I kind of have given myself, like, I'll let you know, I'll say like, let's do breakout rooms, because I gave you know how that just takes longer. And if we start to be short on time, I might have one of them be a group discussion.
Sure.
Yeah.
And
if I do, it'll be the second one, because the anti-racism, cultural humility, I do want them in breakout rooms. People are not comfortable always.
Right.
You know.
And they have been pretty good about using the chat as needed. So I think that's a good option too if you need.
Yeah. I like the chat, because people really will say things in the chat that they wouldn't normally say, you know.
Right.
Sharon, I'm gonna assign you to a room so you can get going and just.
Great. Thank you. Sorry to be a few minutes late.
That's all right.
Yeah, I think like with Zoom, sometimes there's that, is somebody else speaking, pause, you know,
Yeah,
pause
yeah,
like
yeah.
too. So I'm excited. I didn't realize you had a second edition. I've got to put that on my list to get.
Yes, it came out over the summer, I think.
Okay.
Yeah. Yeah, that was my COVID baby.
I love it.
So we should be, how far along are we?
We're
I'm always thinking it's
3
long.
minutes. So
we've
they
gone-
should get, yeah, they should get a, in about a minute, when there's a minute left, they should get a,
I'll get the reminder automatically. All right,
Mhm.
good. Have most people who've done this before did a lot of, no one else did breakout rooms? Am I the first one?
no. In fact, the last two have been conversations. So
Oh, okay.
slides too. So
Oh, really? Okay. Do you think this is too formal? It's just how I do things.
no, I understand, because I prefer slides to organize my thoughts. Otherwise, I'll
Yeah.
be rambling.
Yeah, but maybe I need to make sure that there is time for people to just
Yeah.
ask me questions and stuff like that. So
Yeah, they're usually pretty interactive, or they have been. So I think like that would be good.
So I think the second group discussion will not do in a group. And then the third
Okay.
one, which is the anti-racism culture humility, we will. Because
Yeah.
the anti-racism culture humility, nobody wants to, people are still really hesitant to talk in large groups. You know?
Right.
So,
So they've got about a minute 15, so they should be back soon. Yeah, I find that too. There's a group of psychologists that have been doing like a series of 6 different, and they do an announcement at the beginning that talk about like, make this a safe space for yourself. I really love how they approach it. And, you know, that means like there might, you know, we want you to contribute, but you also need to think about what feels safe and good to you and how to go about that. Right. But yeah, it's still a tough topic.
Yeah.
We, when I do with the Leah groups, it's like silence, you know,
Yeah.
like for a little bit, and then we get going.
Yeah.
Yeah.
Okay, that works beautiful. Oh, see, we have to do it for 1 minute less because.
Oh, I see. Okay.
Yeah.
Okay.
That's okay. For the next one, we'll do that.
Okay. Sounds good.
And I'll also ask you to maybe just help me monitor the chat a little bit too, because it's kind of hard to do it as people.
Yeah.
So I should have just shown up and just see what people had to say. That's what everyone else did.
Yeah. And usually when I'll monitor the chat, I'll just wait for a pause and say, oh, so-and-so said
Yeah,
you
yeah,
know,
exactly.
to help
That's
with
right.
that.
Yeah.
Okay.
I just like the small groups. I don't know, as I've had to been forced to do Zoom trainings, I do more small group stuff.
Yes,
I used
I
to.
do too.
Yeah. All right. So, okay, welcome back, everybody. I'll have, I don't know if people know what group number they were in, but maybe group 1 could tell me, or room 1, who the reporter was. And
that's me. Hi.
hey, nice to see you.
Nice to see you too. So we ended up kind of sort of diving into sort of the MI material and like what gets emphasized and what doesn't. And so some of the things that we of course talked about, and I can't imagine, none of this will sound, not familiar. But a lot of like first like getting on the same page and like giving people a chance to talk about their understanding of what's going on around them, with the EPPE. Then we talked about, of course, avoiding jargon and just, avoiding jargon, avoiding the expert trap, asking them for their own ideas, respecting autonomy, asking people if they want to be part of this process in the first place. So on some level, we struggled with like, how is this different from anything else that we do in MI? But we were able to talk about a lot about, just, what it takes to really engage youth in the conversations.
I think it's a really good question. How does this differ from what you should do in an MI anyway? Like one of the things we found is that autonomy support is like equally important to adults, as adolescents. But I think that, where you get into it is the specific language, like avoiding the jargon. You'll see in the book, we talk about using multiple choice questions sometimes, so that it's not like, what do you think about that? That could be a little bit too abstract sometimes for young people. And also sometimes it's the content. So, when you get into that thing of like, a young person doesn't say anything and you want to be like, well, other people have told me blah, 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 blah. Like that's where you kind of have to be familiar with also some of the content, the peer influences and, what people complain about with their parents. And then the other thing that comes up a lot is understanding to some degree the social media influences that are very different than what we grew up with and that are different than what we use. We know that adolescents use different media than adults a lot of the time. So just making sure that in the engaging, you don't have to be an expert, in all adolescent social media is impossible. Like it changes too fast, but you can making sure in the engaging process that you have a sense of that about what is important to them from a social media standpoint, which we might not normally do with adults. Good. Next reporter in room 2.
I see that Liz has said peer influences in social media.
So we were just right on top of each other.
No, actually, I have a note-taking habit. So so if I do that, I'm just capturing sort of. It's a little notepad.
Good. And feel free to use the chat because Heather will help me monitor that. So group 2 reporter.
Well, we didn't really have a reporter because we got to talking about things and got in some interesting discussion about just how maybe pictures and art really captures a lot more than words do. But George shared a wonderful example, and I wondered, George, if you could share that example.
So this is a little bit of history. I remember from the Montreal Forum that there was no values card sort for kids. And I've done a lot of work with agencies that deal with children mental health issues. And I worked with them from some of the information I took from the forum on how to develop values card sorts for kids, younger kids more likely to respond to symbols and pictures, and then adolescents to graphics. And so they developed collaboratively how to develop, because again, we know how difficult it is for folks to identify their values at that age, and they may actually be developing their values, to develop a child and adolescent centered values card sort as a way of having conversation.
We did something like that with our young adults with HIV and had them develop their own lists and adapt the original values card sort lists. We've also, and in the book we talk about this, we've done it in pictures, draw a picture of what your greatest values are and then draw a picture of how, your behavior, might be discrepant from those values. So we do the values in pictures too. Yeah. Good. Group 3. Any other comments to add?
Yes, just I wanted to mention that Alex said that she in Massachusetts was working with people and used worksheets, and sounded like, although she qualified that it may not be as spontaneous, but it really gave youth worksheets. Thank you.
Yeah.
Gave a platform to have a conversation, whereas, rather than lack of understanding or that blank face.
Yeah, I definitely think experiential materials are useful. I think with worksheets, you just have to, obviously ask for permission, realize every youth is different. Some of our youth hated worksheets and just didn't want anything with paper, and other ones liked them, so it's really something about, choice. And, worksheets are one example. Oh, the other thing is don't call it work. Don't call it homework, don't call it worksheets. Like, I have a sheet here that might, I have an activity, that kind of thing. We pay a lot of attention to like the micro language when we talk to young people, because you can see very visceral reactions to certain words, Good. Last group.
Yeah, so a few of us discussed these ideas and our experiences, and we kind of narrowed down to the ideas that youth and young adults are smart, creative, open to learning people, and that, really respecting their autonomy and choice is helpful in leveraging those strengths of theirs. We talked some too about the idea that it's important to consider the context of change that they're experiencing, particularly social change, for example, and that it's important, if the opportunity is there, to consult with young people about, how to approach different ideas. So if you have the chance to do, a focus group or a panel or what have you, to get some language ideas, or just how to approach, a topic, that would be important to do to really hone in on it in a way that they can access. Anything from our group?
Yeah, go ahead.
I'm just wondering if Fran or Heidi have any other ideas they'd like to contribute.
This is Kate. This is Kate Speck. One of the things I do when I'm doing like setting up the agenda, and we use the bubble, like that bubble chart, like, what's really going on. A lot of times I use pictures in that. So I'll print those pictures off. If I'm working with folks that are in schools or adolescents, it's very different than I'm working with people who have maybe substance use disorder. So I'll put different pictures in there, and then they don't have to come up with something. They can say, oh yeah, that makes sense.
I'm really hearing a lot of the experiential materials. It seems to be something that people find naturally fits with young people, and also can help break some of the silence that you might get with certain clients. I really appreciate what Lisa said about seeing the strengths. And so when I very first started talking about adolescence, I remember Steve Rolnick right away was like, challenges and opportunities, that there's tremendous opportunities when working with young people. It's a time of rapid growth. Sometimes, if you think about the Plinko game where you drop the ball and one little lever of change ends up in a different direction, that's what it's like with young people. I mean, they are at such a critical period. You don't have to fix everything. Sometimes it's just shifting that trajectory a little bit. And then I also try to tell people, most adolescents and young adults do get to the other side. We all did really risky things, most of us anyway, in that period of time, and most do get to the other side. That's the norm, not the opposite. And so to have that kind of positive frame. So, okay, that's really useful. And I'm glad you guys had a chance to talk about that and thinking about the opportunities of working with young people. I wanted to give you a little bit of information about some of the communication science tailoring that we've done in the medical space. And I'm not going to get into too much detail. I've presented some of this before, but a lot of our tailoring came from communication science studies. And we had one study, and Lisa Todd, thank you for help. She really helped lead this. And I believe Nikki Cochran was one of our participants, where youth carried recorders around into the clinic, and it was an adolescent HIV clinic, and they would just carry the recorder from the beginning of the visit to the end of the visit, and we painstakingly coded all the interactions that they had with the physicians, nurses, psychologists, social workers, and paraprofessionals, all in this one clinic setting. And what we did is we utilized the Terry Moyer's and others' method of sequential analysis to look at what were some of the provider communication behaviors from an MI framework that were associated with change talk. And here you can see that what we found, and this has been published, this is Carcone et al. I'll just put it in the chat. Is that closed and open-ended questions to elicit change talk were associated with change talk. And so don't be afraid to use closed-ended questions with young people if you can't get anywhere. And a lot of these were multiple choice. Now, the richness of the change language is probably richer with open questions, right, versus closed, but both can be effective, and that was important. We know here that reflections of change talk were associated with change talk versus reflections of other things, and you'll see in the next slide. And affirmations was weaker, but still pretty strongly associated with change talk. So there's a lot of questions about how much affirmation do you do with young people. I would always say it depends on the relationship, and you don't want affirmation of like, oh, you should be so proud. No shoulds. You know, you should be this, or, you know, but versus like a true, you know, highly specific reinforcement of their behavior. And in the book, we get into a lot of detail about that. And what we also then found is that reflections of ambivalence were highly associated with more counter change talk. And so this is where, you know, the whole debate about, you know, what do you reflect? Do you reflect everything? Really came through for us that was not useful. And open questions that elicited counter change talk were also highly associated with more counter change talk. We pulled out of this analysis the barriers. So if you elicit barriers in a change plan, like, oh, what are some things that might get in the way of this plan? That did not count as an open-ended question to elicit counter change talk or sustained talk. Closed-ended questions that elicit counter change talk were also led to more counter change talk, and as well as reflections of counter change talk. So these things were all highly related to more counter change talk. So I'd like to get your feedback. Yes.
I see that Stephen has his hand raised.
Yes, go ahead. Thanks.
Just a quick question. I love this. What do the percentages mean? I was trying to.
Oh, this was the probability that it would be likely to lead to this. So this was the highest probability, like 66% of the time it led to this. Yeah.
Okay. Thanks.
Yep. And like I put in the chat, the author and the journal, so that you could just Google search that and you'll find the article. So we actually made quite a bit of workshop modifications based on this. We now begin, instead of beginning with ORs, because we found that people latch on to the first thing they learn the most. And if you start with ORs, then they'll just be reflecting everything. We start with change talk. What does change talk sound like in young people? We start with eliciting and reinforcing change talk. We don't use traditional reflections in response to counter change talk. Instead, we talk about stop, drop, and roll. So we might use some feelings reflections as part of empathy. We do a lot of autonomy supportive specific statements. We have developed a whole module around, you know, using you statements like it's really your choice, it's up to you. A whole module around emphasizing autonomy with language. And then of course, this study really allowed us to use real examples from real transcripts, which is really useful when doing training. So I'd like to get your thoughts about this communication science tailoring and how, I'm going to go back to the slide so you can see in the chat, or if you feel like talking, both, can people just give me some of their reactions to how you might modify training based on some of this communication science findings that, or maybe you already have. So either unmute and say something or put it in the chat, your reactions to this. Because this is a little different than, you know, some of the way some people have been training.
I'm curious about a couple of things. One is the reflections in response to counter change talk. That makes complete sense. And I wonder about, rather than a straight reflection or various kinds, but because I tend to like the double-sided reflection, acknowledging their counter change talk. So I've heard them, you know, not dismissing it, and then ending with the, but I heard you say, not maybe not but, and I heard you say this towards you.
So a double-sided reflection that ends in change talk counts as counted here as a reflection of change talk.
Okay.
So double-sided does count positively as long as you emphasize the change talk. Yep, exactly.
Great.
So
Other
Sylvie,
comments? Yeah.
Sylvie, this is Kate Speck. I have a question about that, and I often use the terminology when I'm training as softening the sustained talk. So if all I'm getting is sustained talk and I'm trying to soften it, how does that work in this modification?
Sustained talk is with statements of empathy and autonomy support.
Okay.
As well as potentially affirmation and offering menus of options. And then, of course, the traditional ways of, not traditional, but, you know, from the MI3 of apology, shift of focus, those are all still very much appropriate here. I love apology, I have to tell you. I mean, young people are so not used to being apologized to. I find that it's extremely powerful.
Yeah, thank you.
Yeah.
I have that same feeling about permission seeking, right? That it's so out of the ordinary that it really gets a great response.
I agree with you. I think, you know, I actually think of elicit, provide, elicit, ask, tell, ask, whatever we want to call it, is a part of an autonomy supportive strategy. We actually code it as such at times if it's done in that way. So I agree with you. Yeah. In terms of seeking collaboration, alliance, or engagement, you know, we do have some global codes that way, but when you do the sequential analysis, it has to come out in language, and so it's very specific. We did code for some of that, and it wasn't directly related to change talk. So it doesn't mean that it's not you know, a necessary but not. I kind of feel like it's a necessary but not sufficient condition. Although we do find in some of our studies about MI that we do find reductions in stigma, and we'll talk about this right next. So I'm going to move into this, that there is something about MI that is helps people, at least in our HIV world, that people will reduce their perceived stigma. They feel more accepted and less shamed. And so we actually have found this. Hannah Badwani published a paper on one of our MI-based interventions was associated with reduced stigma in youth living with HIV. So this made us think a lot about anti-racism and cultural humility. And some folks on this call have helped me with this conceptualization, and Maurice Bulls, who's not on the call, has really developed these training components. And so we actually, anti-racism, this is just an example of one definition of anti-racism from Kendi. What is the problem with being not racist? It is a claim that signifies neutrality. I am not a racist, but neither am I aggressively against racism. But there's no neutrality in the racism struggle. The opposite of racist isn't not racist, it's anti-racist. So the idea is that anti-racism is actually an active process, and it's not just about being not racist. And so we brought into this slightly to look at the concept of cultural humility, because we deal not only with people of diverse ethnicities and races, but of diverse sexual and gender identifications. And so we look at cultural humility, which is a lifelong process of self-reflection, self-critique, and continual assessment of power imbalances in the development of mutually respectful relationships and partnerships. It shifts the focus of trying to understand other people to a focus on self-awareness. And so even though in MI, of course, our priority is understanding other people, we talk a lot in training about self-awareness, how one's own perspective may be full of assumptions and prejudices. And core to this process of cultural humility is the person's deliberate reflection of his or her values and biases. So we do spend some time in training now identifying our own values and how those values might improve our behavior in terms of cultural humility. This became extremely important in our HIV work in the Caribbean, where we were working with folks who were very religious and came from the providers were very religious, and they had to rectify the religious values that were very homophobic with the work that they're doing with people with HIV, and we had to really deal with it directly. We have gotten some focus group feedback about people being afraid that MI is too white or too straight. And it has this reputation in the community about it being like a white language and a white approach. And so we talk a lot in the training about how this is tailored for diverse populations. We talk about what's the difference between cultural competency versus cultural humility. We discuss differences between not racist and anti-racist. We have specific values-based activities. We practice how to demonstrate anti-racism and cultural humility in language. So at the end of each MI skill, we think about how can that skill be used to demonstrate cultural humility. I think it's also very important to develop a cadre of ethnic, sexual, and gender minority trainers, some of whom I saw pop in and out on this call. And we ensuring that we have diverse video examples. And so we've actually redone some of ours. I know there's more and more coming out of Mint, which is wonderful. Steve, I see your hand raised.
Yeah, I'm sorry, I keep interrupting. Just quickly.
No. This is meant to be a discussion and conversation. I just tend to overdo the slides. So
well, no, it's not this overdoing the slides. It's dense with gems I want to capture. My question actually now is, Sylvia, is this PowerPoint available to us? It's so rich.
Yes. I will absolutely send it because whenever I do slides that's dense like this, I make sure to send it. So I absolutely will.
Okay, thank you. A lot is very useful. Thank you.
I'm glad. And it may be a little bit repetitive because I'll probably do some of this because I have to do a plenary on this topic for ICME. So I'm not going to promise that it won't, that some of this won't be in there.
Yeah, I particularly love this concept of cultural humility. I'm working on a textbook of medical communication, and we have a chapter on cultural competence and struggling with how to move beyond it. So I want to share that concept.
Yeah, take a look. And there's some videos out there available on cultural humility. So I also want to mention that we have now just taken our first step into trying to code cultural humility, like in a coding scheme. And again, some of the people on this call were part of an expert consensus activity where we tried to figure out how to code it. And here are some of the examples of what we've come up with. And I'm not ready to share that. We're just collecting data on whether this is going to be useful or not and whether people can code it, but some ideas to think about. We code the degree to which the counselor understands the client's culture and values and that influence on behavior change. So really making an active effort to understand the culture, values, and how that influences behavior change. How you investigate the client's cultural values, experience of isms and stigma. So it's okay to ask up front if it's not brought up. Some people have told me that they've really struggled with, experiencing stigma from having HIV. What is that like for you? Oh, I don't want to talk about it. Okay, well, if that comes up in the future, it's something we can discuss, but at least putting it out there that it's okay to bring up those kinds of things. Demonstrated by expressing self-awareness that the provider does not share the same experience or have an a priori understanding of the culture, values, and stigma-related experiences. And so that's a little bit like the expert trap, but around, oh, I've worked with a lot of people from your culture and this and this and this and this, versus like, I have a lot of experience working with, it's okay to say that you have experience working with Spanish-speaking families, but that I need to really understand where you're coming from because not everybody's the same, something like that. And consistently recognizes opportunities to demonstrate cultural humility sensitively and with a guiding approach, and if not present, creates at least 2 opportunities. So we believe that even if it doesn't come up, it's the elephant in the room, and the people I worked with who are from minority backgrounds were very much on board. We had a debate about this. Do you bring it up if the client didn't? And we really believe that in our current environment that you have to. They can always shut it down. So this is a little bit of a contentious approach, and I would definitely like to break you up into groups now for this to get your thoughts about you're not going to have time to process. This is a lifelong journey, but just any initial thoughts or questions that might come up from this particular approach. So let's do 7 minutes and then we'll come back and I think we're going to end there.
Okay.
I'm sorry, I just came late.
Okay, Maurice, let me see. I can get you to join a room.
But I don't know what I have to do.
Just listen in.
Okay.
That's fine.
Okay,
Yeah.
thank you.
No problem. You should have gotten invited.
Sylvie, this is great. It
Yeah.
makes me think about how to change some of my training, because starting with oars, I've been kind of burnt out with that, but also I see where it's like, it definitely makes a difference, and change talk is what they need to know.
Yeah. And we just learn from an educational standpoint, you know, people just grab the first thing they learn. And when you're, especially when you're dealing with either med students super busy or community health workers that don't, you know, all the skills new for them, it's a lot. It's definitely a lot. Yeah.
Yeah, it seems like it could be more efficient too. Like, yeah. Thinking about the hours that we sometimes recommend for training, or like, and we never, I mean, in my setting, we never achieve that, you know, like, so.
Yeah.
Yeah.
I think I'm going to have, just again, in interest of time, have the reporters put their comments in the chat for this one. I think it'll be faster.
Sure. And I made sure to do 6 instead of 7. So.
Right. Oh, smart. Smart. Okay. And then I will send you the, should we ask people to just email me for the PDFs, or do you want to send them out to the people who joined, or how do you want to handle that?
I can send it out to our group if that works.
Sure.
And every now and then we'll get somebody that just reaches out to you from, like, if they're from Mint. I don't know that you want to post them on Mint.
No,
but yeah,
no, probably not. But
maybe asking, I can have them so they can reach out to me if that's easier.
okay. Can you see my slides now? I took them off for a second.
Yes.
Okay.
Yeah, I also love this topic because, you know, most of our folks at the hospital are working with different groups of people. So like really thinking about this is important.
Yeah, it's not specific to adolescents and young adults, but I work almost exclusively with minority populations. So I felt like it was really important to think this through some more.
There's a lot of literature about use of MI with trauma-informed care too, but this makes that link make more sense too. Like, I mean, MI is a great way of communicating, and it's, you know, definitely for someone who's easily triggered with trauma experience. For sure, there's a lot of reasons, but also this could be helpful as well.
Yeah,
I think.
Good.
Looks like about well, 2 minutes, I guess. They have a minute and then they'll get the one. they've been given their 60-second warning.
Yeah.
I think I accidentally left my group early.
That's all right.
Yeah. They'll be done shortly. They don't have too much time left.
Great, welcome back, everybody. In the interest of time, I think I'll ask each group, whoever was assigned as the reporter, and if you didn't, then anyone can answer, to put their comments in the chat of just some key takeaway or theme, that was discussed in the group. And recognizing that this is not a training around anti-racism, cultural humility. I wouldn't even do that in one, in one session, but more just about any initial thoughts or reactions. Steve already gave me some of his, Steve Cole, in the last discussion, which is great. So let's see. And I can look at the chat. So if you guys, each group could put something in the chat. And while you're doing that, I do want to mention that in terms of evidence-based training, we have now completed an implementation trial of tailored motivational interviewing, where we were trained 150 providers in a random assignment kind of way in this approach. In Journal of AIDS, the article will be coming out on tailored motivational interviewing, and we were able to show significant improvements in competency in these domains amongst multidisciplinary providers in approximately, at least 12 to 15 hours total in 12 months. So it wasn't a ton of time. We did an initial workshop followed by some trigger coaching, which again, a whole nother talk, but you will see this article come out. Lisa Todd was the primary trainer. And we showed significant improvements in skill. Everybody improved at the same rate, but because the physicians and paraprofessionals started out lower, they were less likely to achieve advanced competency, but everybody improved their scores about the same rate. So that was my comment about evidence-based training. And I put the article in the chat. So I'm going to go back up. Let's see, we discussed our own awareness and being culturally humble and the importance of continuing to do so, that it's a lifelong process. And one of the trainings I just went through as a participant was around making your own change plan around anti-racism. And, it could be many different things. For me, it was listening to the specific podcast that was in that domain and listening to it every week. And so I kind of keep it fresh in my head, but you might want to make your own personal goal around increasing cultural humility. And let's see, a great way to center the person with whom you're working with and allow them to bring their whole self into the space. So places where maybe they haven't had that direct permission before to bring in their multiple identities, that would be a place to do it. But still tailored to the individual, because everyone has a different identity in relation to their own sexual, gender, ethnic representation. Is cultural relevance inclusive or different from cultural humility? Important to consider both. So I like this is the kind of group that I would be in, where you ask more questions and have answers. And that's exactly the point. Do culturally, racially, ethnically concordant conversations play out any differently from not concordant? Very little research on this. I've looked at this before and I don't think it's clear cut. If anyone knows differently, let me know, but I have not seen any clear cut data on this. Yes, that we need more culturally diverse trainers and ensuring that those culturally diverse trainers have access to MET. So that leaves us a couple minutes. If there's any other open comments or questions that people want to bring up, either by unmuting or putting in the chat. Okay, well, hearing none, then everyone can get a little stretch break before their next Zoom meeting or call. Thank you so much for inviting me, and I will be sending the slides to Heather, so you can reach out to her if you need copies. And certainly reach out to me at any time, because this is near and dear to my heart. Thank you all.
Thank you.
Thank you so much.
Thank you very much. This was great.
Thank you. Thanks, Sylvie. Good to see everybody.
Great to see you all.
Nice job, Heather.
Thanks, Steve. It was a great, I enjoyed learning a little bit from the research and what ideas to change
Yeah,
training. So.
She's